Is the arm or the arms safe to use following breast cancer treatment? Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years. So it's quite common to hear from patients, say, who've had, say, treatment on one side of the arm or the body. Please don't use this arm for blood pressure readings. No blood draws, no IV. And then obviously, the people have both breasts treated, but and for fear of something called lymphedema, where there's this kind of swelling of the arm. But when you look at the research, actually, what it shows is that there really isn't much concern at all. To a point where there's even a recent paper out of Germany where they're saying this whole thing of not taking blood from that affected side is a myth. And so, and I think where this is stemmed from is that when I first started practice, I would say the treatments for breast cancer were much more archaic. So, for example, like every single woman, for the most part, had 15 to 30 lymph nodes removed. That was a standard. Now, for example, they barely remove a few or they'll sample them. And this is why in practice, I rarely see lymphedema these days versus in the past, it was quite common. And one of the things that we've learned with lymphedema risk reduction is activity. Like there was this famous study, Breast in a Boat, where they had these dragon boater women and they were just, doing this all day long, and they noticed that their risk of lymphedema was low. So I just want to, again, dispel some myths and that it appears to be okay to using the arms following breast cancer treatment.